Caring for your nephrostomy tube. In this video, we are going to share some information with you about nephrostomy tubes. First, we will review how your kidneys work and what can happen if they become blocked. Next, we will explain what a nephrostomy tube is and how it helps fix problems caused by blocked kidneys. We'll explain how you can take care of your nephrostomy tube, including common issues and complications that you may have with the tube and how you can handle them. Finally, we'll answer some frequently asked questions about living life with your nephrostomy tube, including activities you can do, showering, ordering supplies, follow-up care, and more. First, what are the kidneys and what do they do? Most people have 2 kidneys located on each side of your back, 2 ureters, and 1 bladder. The kidneys filter the blood in your body. They also make urine, or pee, which travel down tubes in your body called ureters and into your bladder. Sometimes the kidneys can become blocked, so urine cannot drain through the ureters into the bladder. This might be caused by a kidney stone, an infection, or scar tissue, which can cause a stricture or narrowing of the ureter, or cancer. Without a way for the urine to get down to the bladder and out of your body, you may develop pain or an infection. To fix this problem, interventional radiologists can use X-rays as a guide to place a tube into your kidney to drain the urine. We insert this tube, called a nephrostomy tube, into your kidney through your back. The urine from your kidneys moves through the tube and collects in a drainage bag outside your body that is attached to the tube. There's also a valve at the bottom of the drainage bag, which can be released to drain urine into a container or the toilet. There may also be a little lever called a stopcock connecting the tube to your bag, which when it is turned will either stop or allow the flow of urine. Sometimes, the stopcock is only a one-way stopcock with an open and closed position. Other times, it is a 3-way stopcock which has a separate side port for a syringe. This is how your tube may look coming from your back. Here is the stopcock connecting your tube to your bag. This is a one-way stopcock, but your tube may have a 3-way stopcock with an extra side port, or no stopcock at all. Now we will talk about how you can take good care of your nephrostomy tube. It is important to take care of your tube daily and come to all of your appointments to prevent an infection. There are 3 main parts of tube care: dressing changes, emptying and changing the bag, and flushing the tube. After your nephrostomy tube is placed, you will have a dressing at the tube insertion site. This dressing needs to be regularly changed. To do a dressing change, you may need a mirror or a caregiver to help you. You should change the dressing around the tube every 3 days, after showering, or if it gets dirty or wet. To change your dressing, you will need 2 clean washcloths, which should be brand new or freshly laundered, mild liquid soap, a 4x4 gauze pad, a 4x4 drain sponge, also called a split gauze pad, and paper tape. If you do not have a drain sponge, you can cut a slit in the gauze pad and use that instead. Start by washing your hands, then remove the dressing. And look where the tube comes out of your body, called the exit site. Make sure it is clean and secure. Often we will secure your tube with stitches on your skin. Clean around the tube with 1 clean washcloth using mild liquid soap and water. Rinse well and pat the area dry with a 2nd clean washcloth. Apply a new clean drain sponge and a gauze pad and secure it with paper tape. Be sure to position the tube so it does not kink, fold, or bend. If you see a kink, reposition the tube. You can secure the bag to your leg with an elastic band. Leave your tube draining to a bag unless you are told to put a cap on it. It's important to keep your bag below the tube to avoid urine draining back into your kidney. You can attach the drainage bag to your leg using these elastic straps. Take the straps with their buttons and thread them through the slots on the bag. Then take the elastic band and wrap them around your leg and use the Velcro to secure them down. Now the bag is secure on your leg. Make sure to empty the bag before it gets full or every 2 to 3 hours. You will need to change your drainage bag every 7 days. To change the bag, first wash your hands. If your bag has a stopcock, turn it so it is in the closed position. Disconnect the bag from the tube and put it to the side. Wipe the end of the tube with an alcohol pad. Then connect the new bag. Make sure to turn the stopcock level back to the open position so urine can drain back into the bag. If it's time for you to change your drainage bag but you do not have a new bag, you can clean the bag after you remove it from the tube and then reattach it. Use another container like a basin to collect your urine while you clean the bag. To clean the bag, fill it with 2 parts vinegar and 3 parts water and let it stand for 20 minutes. After 20 minutes, empty it out and let it air dry. Once the bag is dry, you can reconnect it to your tube. Most of the time, you do not need to flush your nephrostomy tube. However, if your provider instructed you to flush the tube, you will need a saline flush. This will have been prescribed to you and sent to your pharmacy. Do not flush the tube with any other liquid unless instructed by your provider. Take the saline syringe out of the packaging and remove the cap. If you have a one-way stopcock, turn the valve to the closed position and disconnect the bag. Attach the syringe to the open end of the stopcock by pushing it in and turning clockwise. Turn the valve to the open position and push the plunger in to the amount that your provider told you to use, which is usually 5 to 10 milliliters of saline. Turn the valve back to the closed position, then turn the syringe in a counterclockwise direction and pull the syringe away from the tube. You can then connect the tube to the bag and make sure to turn the valve back to the open position so urine can drain into the bag. If you have a 3-way stopcock, there may be a cap on the side port. Turn it counterclockwise to remove it. Attach the syringe to the side port on the 3-way stopcock by pushing the syringe in and turning the syringe clockwise. There are 3 positions you need to know on the 3-way stopcock: open to the bag, open to the syringe, and closed to the patient. Make sure that the stopcock is in the open to syringe position, pointing towards the drainage bag. This will make sure that saline travels down into the tube. Push the plunger of the syringe in, again to the amount that your provider told you to use, which is usually 5 to 10 milliliters of saline. Then turn the syringe in a counterclockwise direction and pull the syringe away from the side port. Turn the valve on the stopcock back to the open to bag position to allow urine to flow back into the bag, and then you can put the cap on side port on if you have one. If you do not have a stopcock, you can just detach the bag directly from the tube and then attach the syringe to the tube. Then you can go ahead and push in the plunger and flush directly into the tube. Without a stopcock, you can expect some leakage when you disconnect the bag from the tube. It is normal to have some issues come up while taking care of your nephrostomy tube. Here's what you can expect and how to handle them. After your tube is placed, you can expect to feel some pain or soreness at the tube insertion site. This may last up to a week or 2. This should get better with time and may improve by taking over-the-counter pain medication like Tylenol or Motrin. It's common to have some fluid leakage or drainage around your tube, especially right after the tube has been placed. Check to make sure the connection between the stopcock and tube is secure and that the stopcock is in the open to bag or open position. You should also make sure there is no kink or bend in the tube to prevent drainage. If your provider instructs you to, flush the tube with saline. If you try to flush the tube and it is not working, do not force the plunger. The tube will likely need to be changed, and you should call the interventional radiology department to schedule an appointment. Now let's answer some frequently asked questions that patients with nephrostomy tubes often have. When should I call for help? You should call the interventional radiology department if any of these things happen. Your tube falls out. If this happens, your tube must be replaced within 12 to 24 hours. Make sure to cover the hole in your skin with gauze pads and tape until a new tube is put in. If you have back pain, chills, or a fever greater than 100.3 degrees Fahrenheit, this may be a sign that you have an infection in your kidney. If you have abnormal or bad smelling drainage or redness around the tube, if your tube stops draining, or if you notice more urine leaking around the tube and onto your skin and dressing. To reach the University of Michigan Interventional Radiology Department, call 734-936-4500, then press option 1 followed by option 5. You can call and reach us between 8 a.m. and 5 p.m. Monday through Friday. If you need urgent help after hours or on the weekends, call 734-936-6267 to reach the interventional radiologist on call. If you think you need emergency care, call 911. When do I get my tube changed? You will need to have your tube checked and changed usually every 6 to 8 weeks for as long as your tube is in place. Sometimes your doctor may recommend a shorter or longer time frame between tube exchanges. If for some reason you did not receive an appointment for this when you were discharged from the hospital, please call the Interventional Radiology Department to schedule your tube change appointment. When will my tube be removed? Typically, the tube stays in place until the blockage is resolved. However, your urologist and interventional radiologist will talk with you to decide if or when you can have your tube removed, depending on your treatment plan. Can I shower? Yes, you can shower with the tube, but do not take a bath or submerge the tube under water. During the first 2 weeks after your tube is placed, cover the dressing with a plastic wrap and secure with tape whenever you take a shower. When you finish showering, remove the plastic wrap and tape and change your dressing. 2 weeks after your tube is placed, you can shower without the dressing or plastic wrap. Make sure to rinse well after using soap. When you're done showering, pat the tube insertion site dry and put on a clean, dry dressing. What activity should I avoid while I have a nephrostomy tube? Avoid any activity that causes a pulling sensation around the tube, pain around the tube, or kinking of the tube. Avoid activities such as bending forward or lifting heavy objects, as this may cause leaking around the tube. Avoid putting creams or ointments around the tube insertion site unless your doctor tells you to. Avoid submerging the tube in any type of water, including tubs, hot tubs, pools, oceans, ponds, and rivers. What should I eat while I have the tube in? You can eat your normal diet. If your stomach is upset, try eating bland, low-fat foods like plain rice, toast, and yogurt. Drink plenty of fluids unless your doctor tells you not to. What medication should I take? You can take your normal prescription medications as instructed by your doctor. Where do I get supplies to take care of my tube? After your tube is placed, you should receive supplies to go home with for changing your dressing and drainage bag. If you run out of supplies, you can order more through a supplier. Please contact the Interventional Radiology Department if you do not know how to order more supplies. We hope this video has helped you feel more confident in managing your nephrostomy tube. Thank you for your attention.